My mom died of cancer and it tore me apart. Hi, welcome to my YouTube channel. My name is Brian and this is the Ivy Cancer Podcast. The death of my mom had inspired me to interview people with cancer or who have been affected to help spread awareness. The broader my subscribers are, the more people will be motivated to share their story. So if you come across this platform and you would like to help me achieve this goal, please hit the subscribe button. It will be greatly appreciated. A video will be uploaded every Wednesday. Thank you. How are you doing?
I am doing well. I'm a bit hot, but I'm good. I'm doing
Trust me,
fantastic.
I'm not even going to say anything because I am cold. If it's one thing I don't miss about Jamaica, I don't miss the heat.
The heat. Oh gosh.
Yeah,
But it's bearable.
I don't miss the heat at all. So how your day has been?
My day has been good. A bit, it's good. I can't complain. It's a blessing. Mhm.
Okay, definitely. So we have to give thanks, innit? Yeah, you
That's
didn't
right.
already?
No, I haven't. As
What
I'm done, that's the next step.
what's for
Mhm.
dinner?
But well, we're going a bit natural. We've
Yeah.
been going natural for a while, so it's just like vegetables, straight vegetables just for a while.
You need
So,
I'm trying to transition as well, you know. Like I've been
okay.
eating less meat now. So like for even
Okay.
for this week, it's
Mm-hmm.
half meat,
Mm-hmm.
um and half just natural vegetable, straight plant-based vegetable.
Okay.
Yeah, I
And
am
so have you been mixing the meat with the vegetable as well? Can you
no,
mix?
no, the meat, like I have two lunch per day. So like the meat is for the morning part of the day, and the
Okay.
evening lunch is just vegetable, no mixing of the meat, nothing.
Okay. So I believe that what my friend Ken, the nutritionist, would
Yeah.
definitely agree it's good to have a balanced meal.
Yeah,
So mixture of meat, vegetable, and carbs.
she's
So that is important.
supposed to be doing a meal plan for me soon.
Okay. And that is also important for your oral health as well.
Definitely. Okay. So first of all, I just want to say I am happy that you are here on Ivy Cancer Podcast. Um
Thank you.
guys, how I don't know Shanna, right? We're just officially meeting face to face, and or we come across path. My official guest that I was supposed to have this week had canceled on me, and so I contact Kayan because since Kayan had promised for a part two of a nutrition podcast, and she wasn't available, so she said she have a few friends that she can contact. And Shanna was so busy, and she took the time out now, to share with you guys about oral health. But first, um, Shanna, why do you choose dental health as a career path?
Why did I choose dental health as a career path? Well, honestly, I would say naturally, I have a passion for healthcare. That's me. Healthcare, that's me. And because of that passion, I wanted to do medicine initially. However, that didn't turn out as how I wanted it to. So I was like, you know what? I want to do something in the health field as a career. Nursing was another option, but I'm like, you know what? If I do nursing, I might be overworked because I give so much. And somehow I came across dental hygiene. I was basically just browsing, thinking about the health. I think there was something concerning somebody I knew concerning some oral issue that they were having, and somehow the fascination. I started doing research to help them, and then the fascination just started there and then, and I basically did a more research to find out where I can pursue this career path, and I found out that the University of Technology offers this program, this degree program. So that's how I got into dental health because of my passion for helping others and my curiosity.
Okay. Where did you study?
I studied at the University of Technology. The program is called the Dental Hygiene Accelerated Program. It's a Bachelor of Science degree.
Okay, so do you have a PhD in dental hygiene?
No, I don't have a PhD and PhD in dental hygiene, and it's not offered in dental hygiene either.
Okay.
Concerning well, here in Jamaica, the next level, which is the master's level for dental hygiene, is really on dental therapy,
Okay.
right? And that's basically focusing on oral health in a more tertiary level of healthcare, but we focus on children. So extractions can be done, fillings can be done, but it's mainly done on children. So
Okay.
that's my premise.
Okay. You sent me a follow request this week and on your TikTok. And because we were trying to see if you could go live on TikTok and um we because of the following, you don't have much followers, so unfortunately you couldn't go live on TikTok. But I noticed that you're promoting a hair product. Tell us about that hair product.
Okay, so my business is called Lucian Essentials. Currently I've actually created two products. The one that you actually saw on my page, that is a moisturizer. So that basically helps to nourish the hair. It has everything. It has water, oil, and butter. So it's like a lock system. So with that now, it basically provides the nutrients it needs to feel to remain soft and nourished and moisturized. Also with herbs that I have implemented in it that basically help to give that extra boost of nutrition to the hair. And yeah, so that's basically it. And also have essential oils in it to even help to promote health food. So here goes, sorry. So basically that's what it is. It's a nourishing moisturizer and it helps for your
Hi. YouTube have two ways to push your channel. With that said, I'm asking you two quick favors. If you like what I'm doing and want to support my growth, please give me a thumbs up so that YouTube could send my videos out to like-minded viewers just like you. 2. I've noticed that 70% of you who have revisited this channel have not yet subscribed. Please hit that subscribe button. That way my channel will grow. And my promise to you is to give you more content with substance just like these. Do we have a deal? Thank you.
hair growth. It helps the hair to remain soft. It helps it to remain nourished as well. And it just gives it a fuller look in terms of the growth because it promotes hair growth.
So I notice your hair. I can't help but notice your hair. You have a your hair is long and it is natural. Is all of that your hair?
Yes, it is. This is all my hair.
Would you say that the product that you've been promoting have a contributing factor to that?
Yes, I would say it does. And others have used my product and they've basically gotten a lot of results. Um, for me, so the moisturizer came in effect when I basically went back natural. I wasn't always like this. So I went back natural. And that was in 2014. And I was just using shea butter and just other things, but my hair wasn't getting much grow. And honestly, I prayed to God, I got the formulation to create this nourishing moisturizer. And along with the moisturizer, I would say as well, what contributes to it is my technique. Every time I wash my hair, or I would say I never wash my hair dry. So before I wash my hair, I steam my hair with conditioner oil and aloe vera. That's my number one combination. And that helps to strengthen, nourishes my hair, and then I'll cleanse my hair. How I'll cleanse my hair is I'll focus on the roots after I've steamed my hair. Then I'll apply the shampoo to the root of my hair, cleanse the root of my hair, let the water and oil just kind of run down, wash down the hair. If you have a lot of product built up, you can add a little more shampoo to it, cleanse it, and then I'll condition. And that's really helped me as well. So the moisturizer, which was the main thing, because I've given others the moisturizer and they don't use that technique in terms of what hair washing, and they got a lot of
So you produce this hair product.
Yes, I made it. This is
So
with prayer and research.
okay, so we will definitely speak more about your hair product in a minute. Um,
Awesome.
so okay, so how does oral health connect to our overall health?
How does oral health connect to our overall health? Basically, we all eat. That's that's the first thing I would say. So basically, by just the consumption of meals, that's well meals and that's what nourishes our body. That's a connectivity right here. So the oral health and the body. Concerning oral health and the body as well, let me be more specific. Basically, the oral cavity consists of a lot of tissues, consists of a lot of um aspects of the organs as well. And basically everything coming together, it basically helps to create a natural symbiosis with the body and the mouth. You know, per se, for instance, if sometimes if you're facing a terrible toothache, it affects how you eat, right? Sometimes you're in so many pain, this are the head start person. You can't eat, you can't function any at all because of poor oral health,
Yeah.
right? And with that connectivity, that is the way of life. Because if you're not able to eat properly, and not necessarily eating, but if you're not able to basically go about your way of life, you are unable to produce or to work as how you need it also. And that shows the connectivity concerning the quality of life. Concerning the health as well, what happens is if the oral health is poor, there it naturally triggers an immune response. And so this affects your immune system. Concerning your oral health as well with regards to your lungs. What happens is bacteria basically accumulates in your mouth and viruses accumulates in your mouth. It can go into your lungs and cause lung issue, pulmonary issues. So there's a connectivity to the overall oral cavity and the body.
Okay. Okay.
Mhm.
So as you said that it plays an important role in our overall health. So it's good to have a
Yes.
good hygiene, right?
Mhm.
Overall hygiene.
Yes.
Okay. Flossing. Like, should we floss or is flossing, how often should we floss?
Yes, we should floss. I definitely recommend everybody to floss at least once a day. What happened is, all right. So sometimes what happened is some people are not knowledgeable of the proper technique of brushing, also the type of toothbrush you use to brush and to
Mhm.
get the proper brush as well. However, even if you do know the proper technique, the bristles are a bit too large to really put in between the teeth. And also when you're brushing, the bristles go in the bacteria are also in the gum line, so you should be able to angulate the toothbrush in a direction where it brushes the gum line. Because it's not able to go in between the space, let me give you a little demo. Right. I have a type of them.
You actually have your
Alright,
teeth
so
there.
because they're not
Yeah. Yeah.
I have my teeth. Yeah, and I have my floss here as well. So
Okay.
if you're not able to do so, right? Let me show you what area you miss when you're brushing the tooth. You tend to miss between these areas, the
Right.
pockets between
Right.
the ear right here, right? In the gum line. So what happens, the bristles cannot go between the areas. So the floss, let me try to see what I can do. The floss is able to go now in that area,
Oh,
in within the gum line as well, you
yeah.
see, and clean that area properly. You
Okay.
understand?
Right.
So definitely I recommend flossing. And when you floss, it also prevents gingivitis, particularly gingivitis starts from line. If you're able to clean it properly, then you'll basically able to get rid of most of the bacteria in the area.
Yeah. Someone would say every time they floss, the gum bleed.
Mhm.
What would you say to those person?
Mhm. So sometimes a possibility that they're flossing a bit too hard.
Hmm.
They are just jamming the the string into the gum and just pushing down on it like that, rather than trying to conform to the curvature of the tooth, which is basically like a lasso around the tooth.
Hmm.
Let me see if I can do it. So can I have the string like this, the floss like this? Let me try. So I would like this around the tooth, like a lasso, and you basically clean the area. So it prevents you from basically targeting directly the gum,
Right.
going down too hard on the gum. So once you conform it to the tooth, you get better connection, I would say, to the area. And you're able to floss it. Sometimes as well as because they have gingivitis. Even no matter how gentle they try to floss, because the area already is inflamed, the flossing basically I would say, I wouldn't say hurt the area it kind of causes the area to bleed if it's there once the device is there. And a little touch, even a toothbrush causes that once the device is in the area.
Okay.
Mhm.
Okay. So we understand the techniques of flossing. Guys, I know you probably
Forming to the tooth and not pushing it, carrying it down between the two.
right. So I know you're
Mhm.
probably wondering why you're hearing the person, but you're not seeing the person. We are conducting this meeting, this podcast via a Zoom. She don't have enough followers, so you can subscribe to our you can follow her on TikTok. It's what's your TikTok name again?
Niche essentials.
Nishin.
I can niche NECHYN essentials.
Right. So you can go over there and follow her so she can have enough followers. So we can probably have a part two next time on TikTok. But the video will be uploaded on the YouTube channel, so you will see what she was showing us. Fluorides. It has been a
Mhm.
controversial thing in my head. I'm not sure about everybody else, but what are your take on fluorides as a dentist?
Okay. So fluoride is important. It has its place. Too much fluoride oral can cause or give an adverse effect to the body as well. So, all right, fluoride is basically component is included within the mineralization, helping to get the, get basically mineralizing, basically helping to harden the tooth or make the teeth stronger. Right. So, the lack of fluoride can tend to cause cavities, and that's why we try to basically encourage those who are in areas where the water is not fluoridated to basically try to consume to have a regular checkup, especially with children. In Jamaica, we have a system where fluoride is implemented into a salt. Our salt has fluoride, so we put fluoride because fluoride is really a systematic compound. That's how it basically works through our system. So in Jamaica here we have the fluoridated salt. In some countries, in some states, they have the water that is fluoridated. So basically, as I said, with the mineralization of the tooth, preventing tooth decay, it is important. However, if too much is ingested within the system, it can cause fluorosis.
What
And
can it cause?
that fluorosis. So it's
Fluorosis.
basically, I don't know if you've seen, yeah, fluorosis. I don't know if you've seen persons where the teeth are a little bit discolored and a little bit pitted because it can be a bit too, it has some brown discoloration on the tooth or some white, extremely white discoloration on the tooth.
Right.
So that is basically the fluorosis. And as I said, it's a systematic effect or response. So you try to basically, well, what organizations try to do, what systems try to do is basically try to limit the amount of fluoride is required for the body. And what we as dental professionals try to do with children is whenever they come in, which we recommend at the age of 3 and upwards, they basically come by, we give them a quick oral checkup, and then we give them fluoride treatment. And this will help to prevent tooth decay, which can be very uncomfortable, very uneasy for a child
Right.
because it's tooth decay comes extractions. I've been there. So I would not want a child to go through it. It's
Yeah.
not a nice feel. So
I,
that is my take on it, and it has its importance, of course, as a particular amount.
as a child, I can remember going to the dentist with my dad, and
Mm-hmm.
I don't know what caused my tooth to look like that, but they were fine and they were black, like, you would say rotten teeth then.
Mhm.
I had to go to the dentist at a certain age to take them out so that they could grow back fresh. What causes those as a child growing up? Like, could it be sweets or could it be what we eat?
Well, a lot of different factors. What tends to happen to children is basically improper oral health in terms of brushing. That's the simplest thing as brushing
Brushing is
properly.
important.
It is very important. And how we brush is also important. The type of toothbrush that we use also is very important. It is important because you want with a child, well, most persons, you basically recommend soft toothbrush. Like for adults, you can implement medium bristle toothbrush, but soft toothbrush, bristle toothbrush is important for children because, as I said, with the tooth while brushing, the bristles need to go down into the gum line and also on in the I would say the pits and fissures of the tooth. So you know the tooth, the surface of it is not smooth. So you want to ensure that the bristles are soft and small enough to even go into those areas of the tooth. So it's less painful at brushing. And with that nose, sometimes our children will say improper brushing, each house has sweet, but not necessarily sweet. It's really bacteria. If you're not brushing your teeth properly, if you're not brushing properly, you're going to have an accumulation of bacteria in your oral cavity. So in that country, those are the things that really causes the bacteria. So bacteria are there that feast on the sugar in the mouth if you don't brush your teeth properly, whether it's like some candy or just eating some rice, because they both produce sugar and have sugar within them. So the bacteria basically feast on the area. And if you're not able to brush your ear properly, if you're not brushing properly, especially for children, it's going to be able to have toothache, and sometimes it can release an abscess, which you don't want for a child. That's an infection, the tooth is infected. So the brushing, as I go down to brushing, that's the primary part of dentistry. Brushing is important. For care of the oral cavity is important. And that's what I mean, everything that really contributes to the tooth.
All right, I want to ask you a question, but someone in the comment section asked a very important question, and that
Sure.
is, what about with pulling and brushing using coconut oil?
Fully done coat brushing using coconut. Okay. I know that's a remedy per se, some people will use. However, this is it. With the bacteria that is basically present in your mouth, it needs more than just basically like I would say like liquid motion to or swishing to remove them properly. They build a film or by layer on the tooth that needs the um tactile motion or something abrasive to basically gets that break up the bonds. There's something to break up the bonds between them. So basically can be removed from the teeth. Um Swishing with the coconut oil, it's not solely recommended. I would not recommend that to basically keep your oral cavity clean. That's not good because even your tongue, it doesn't get, we need something to clean the tongue as well. And if your teeth per se is clean per se, bacteria, the food is on the tongue. Bacteria is on the tongue is transferred to your teeth. So
Okay.
it's a whole system, it's a whole bio that this kind of works together. They're all connected and they try their best to be as resilient as possible to create their environment within your mouth. Yeah.
Okay. The question I want to ask is,
Mm-hmm.
how often should we brush our teeth?
How often should you brush your teeth? At least twice a day.
At least
At
twice.
least twice a day. Yes. You brush. What I recommend to my patients, the time of day to brush. I recommend that they. So let's start from the starting, right? You go before you go to bed at night. Brush your teeth before you go to bed at night. When you wake up in the mornings, have your breakfast. You brush your teeth after. Once you're able to maintain that pattern, you realize, oh, okay, I can't get stuck because I can't get stuck and brush my teeth like that without eat. I can't even brush my teeth first. And I'm like, once you maintain that pattern of basically brushing your teeth before you go to bed at night, and then eat and then you brush after, you realize that the bad feeling you had in your mouth, everything is not there in the mornings because it's a pattern. You basically maintain that cleanliness throughout your body, throughout the oral cavity. So I would recommend brushing at least 2 times a day, brushing before you go to bed at night and after you eat breakfast in the morning. And trust me, and flossing at least once. You get a really good feel. I recommend flossing before brushing as well. Clean that area first. Clean those areas first. When you floss first, then you basically go with the toothbrush and the toothpaste and everything. Is that it cleans between the teeth as well, with the toothpaste and all that stuff. So I recommend that as well for my patients.
Okay. How often should one visit the dentist?
You should visit the dentist at least once per year.
Once
Every
per-
6 months, just basically once per year. Yes,
Okay.
that is important.
All right. So when we had our first discussion, and this is something that I've been thinking about since we had the discussion, and I want to touch that topic now. Fashion braces. A lot of young people tend to want to go in fashion braces because I can remember when this entertainer put on braces, Vybz Kartel. Everyone started to doing it, especially the younger kids. What are your take on fashion braces?
All right. So I can't say that exactly, or I cannot speak on the entertainer's and his procedure because I don't know what he did. I think it was professionally done, that's what I think, but I can't give a definitive answer. But the fashion bracelet was basically an easy way to go for the young people because it looks like a trend. It looks cute, it looks nice, it looks fast, it looks rich, right? So my take on fashion braces, it's a no-no.
It's
I
a
do
no.
not recommend. No, I do not recommend it to anybody. I have seen persons in my life, and I've seen patients who wear fashion braces and the outcome of it. It is not something that is favorable. All right, this is what happens. When you wear fashion braces, or the person who even installs the fashion braces, they have little to no knowledge about the aspect of orthodontics. So they'll basically just get the ones that are, because you have braces that are sold. These fashion braces are naturally poorly manufactured, of course. So they have poor materials. So that's not good for the system. Sometimes they seem to have lead in it. They leach into the system. It can even cause poisoning. So that's what's one of the aspects. That's one of the downfalls.
So
One of the major.
let me catch up with you. You're saying some of the material that used to make these fashion braces are not proper material, so it causes poisoning into the body. Okay.
Exactly.
Okay.
Also, apart from the material, sorry, the the effects. So it basically causes gingivitis and leads to periodontitis. So gingivitis that I've explained, well, let me explain more about it. It's basically when the gingiva or the gum becomes swollen, it becomes pink or red because it's inflamed. Because there's a built up, sorry, bacteria in the area. So that's basically the accumulation causes gingivitis. If you're not able to brush in the area properly, even if you do brush in the area, it's gonna cause bleeding. So when that happens, sorry, fashion braces tends to cause that. It causes that in patients. And the persons who even install these things, they don't even give you information because they don't know as to how to take care of the braces or how to take care of the teeth. So they drink these things somehow. So when that happens, that can be very painful. Now, when it leads to periodontitis, so periodontitis is basically when it moves from below the gum line, from the gum line, and it goes below. It basically affects the bone and the connective systems in the area. Then the bone basically starts to recede. You barely have any structure to basically to maintain your teeth or to hold the teeth in place. So your teeth tend to chip. When the shifting happens, because the bone is here, the issue is when the bone is destroyed, it can't be rebuilt like that because it's like a rapid bone drop. So the cells and the chemical response, everything is there. It's not there in the ear to basically rebuild the bone because of what's happening in the time span. Cells take a while to regenerate and all that stuff. So because of that, it prevents that from happening. So once you have periodontitis, that is the case. In order for you to be able to get bone in the ear, you have to do a bone grafting. That's the periodontitis, right? That's more money for you. When the bone basically receives and gets very instruction, you have to get extractions done. Yeah. So that's it's more money for you to say periodontitis. No, I was talking about the extraction. Sorry, it's an extraction done. So you have to get those teeth out because your teeth is basically moving. You can't eat because the teeth is moving. Teeth basically shaking. So that's another thing. So that's what we do not recommend it to patients. To teeth in general. I know it's cute, I know that, but it's better to have it professionally. Also, with orthodontics, it is very specific to the person and the cause and the issue that they're having. So one type of I won't say bracket, but one type of installment might be different from somebody else's. So it just all depends on yours. And another thing with orthodontics, for them to even give a proper diagnosis to even use it, for you to get the installment, you have to do x-rays, you have to do panoramic x-rays, you have to do all of those things, which person who installs it or fuck installs it does not do. So they don't know anything outside about it. Right? So these things are important. The bone structure is very important. It sadly a lot of persons do suffer from that. So I definitely do not recommend it. I would tell everybody to stay away from fashion braces if they will need braces to be done. You can, well, it depends on your situation. You can look into cosmetic dentistry, and that is now done with a dentist and also the orthodontist, but it's not so invasive or so struck. I wouldn't say struck, but it's not so, it's not so invasive per se. You can need a little straightening of the teeth per se. But my major issue is just a disease that it causes. And it tends to cause decay as well.
Yeah, I was just going to get to that. Like yesterday, I was in town, and I passed a little girl. She was smiling, and she had on her braces, and there was so much plaque on the front of that. Like, how does one really take care of their teeth when they're having braces?
All right, so getting orthodontic appliances to care for your oral cavity. There are flosses that are basically made specifically for braces. So you can use those kind of flosses. There are also water flosses as well. So you can use the strings, orthodontic floss, the water floss. You can ensure that you brush your teeth and visit your dentist on a regular basis. Because normally with orthodontics, sometimes the dentist recommend to come in maybe every 3 months just to check the process and probably just a few. Just based on how you're maintaining it. It is something that is a bit painful because the thing with orthodontics is you're basically shifting your teeth, whether or not it's fashion braces or not. It shifts your teeth because they're shifting in it. Because the movement that is basically not normal per se, but when you're under orthodontic guidance, they would know how to position the braces properly, also basically know how much pressure to put on it so it's not too much, where the bone is able to collapse and rebuild within that time and pressure. Somebody who has a fashion braces, they don't know these things, and that's why persons suffer because of that trend.
Okay. All right. We still haven't finished with the fashion, but someone is asking what kind of product is the best product to use on your teeth. I'm not sure what they're really asking.
I don't know. Product, can you specify?
Is charcoal powder recommended for brushing teeth? I guess it's powder that should be. Someone is asking if charcoal is good for brushing teeth, and the question is, what's the best product to whiten the teeth?
Oh, so whiten the teeth.
Yeah.
All right. Let me speak about the charcoal first. Charcoal is not necessarily recommended. I know it's also a trending factor per se. And
Yeah.
people who
I
may
just
or may not.
I just finished a tube of charcoal toothpaste. So you're telling me say a waste?
Question. With the charcoal toothpaste, do you have issues with hot or cold?
No,
Whenever you eat or consume toothpaste hot or cold?
no.
Okay. This is the reason. That's another thing. That's a charcoal toothpaste. Is that's a case with the toothpaste, or you just got your own charcoal and just mix it? What is it? Is that
I
product?
get the toothpaste.
You got the toothpaste, and that's different.
Okay.
People literally get the charcoal and mix it with the toothpaste. That's
Oh,
how they
okay.
do that. With
Okay.
the toothpaste, it's fine because they're able to basically crush per se the charcoal into a small part of it where it doesn't cause the teeth to become sensitive. Sensitive meaning that sometimes the particles are a bit too big and it can cause some serious abrasion and the
Okay.
tooth disrupting the structure of the tooth. So it tends to be sensitive, right? So the toothpaste is fine, but with just the use you're getting the charcoal and just doing it, no, not necessarily recommend because you're going to have sensitive.
Okay.
And also you can have issues with the gingival, the gum. You cannot bleeding in the gum as well because
So the powder is not advisable.
not the point. If you want to get the toothpaste, fine.
Okay.
Definitely, yeah, man. Because it's to the company and the brand, but you do it on your own, just getting it and just making it and it's not
Okay.
it's still too large for the tooth surface.
Okay.
So it will cause an abrasion. The product concerning teeth whitening. Um I teeth whitening are different systems to teeth whitening. I have done in office teeth whitening. I don't necessarily recommend also office teeth whitening, but it can be done. Reason being is persons in need guidance concerning teeth whitening.
Yeah.
So I think it's the Opalex system. That's the idea. I used that one. That was good. But what is in office. That's a good system to use for teeth whitening. Concerning the ones that I bought purchased online, I can't give a recommendation. I'm not sure to be honest.
Okay.
But I'll just recommend somebody if you're doing teeth whitening, see a dentist first, have a checkup, and then you can ask them about it. Let them know what system that you're interested in. If that is out of office, they will guide you, but you need instruction. Sometimes teeth whitening can cause serious sensitivity to your gums. You don't want that. Another thing with teeth whitening, you'll rather it's better to have a cleaning done first before you do a teeth whitening. All right, because you need to get the biofilm, so actually you need to get those off the teeth to get a proper teeth. So, as I say, concerning the product, I can't really give a recommendation, but I'd rather see a dentist, ask them concerning get a cleaning done, and ask them the recommendation. What they recommend for out of office.
Okay. All right. We had agreed for an hour and we well over an hour. And I know you're a busy woman. So when this Zoom is finished, I might just hopefully I can get a part two to this program from you. So in the meantime, how do one reach you if they need to get in touch?
Okay, so my social media handles. I am on TikTok as CST Information Essentials. You can still contact me there. I'm training for help. I am always happy and willing to help. And also on Instagram, you can find me on Instagram, Mission Essentials, or you can contact me through Shannon Squire. That is my Instagram.
Okay. So I will put these information, guys, in the show notes on my YouTube channel. So you can contact her and she could give you more information about dental health. But I will keep my fingers crossed. We might be able to have a part two to this, given the time span. Hopefully that I can be able to afford the Zoom next time so that we can have a longer Zoom session. But Shanna, I really do appreciate you passing through, taking this time out from your busy schedule and to give us these valuable information that that we definitely needed. Thank you for coming.